lurking around and thriving better in this atmosphere. But let's set the foundation first, Doc. What do you term as an infection?
Infection. That's a good question. Infection is pretty much when the germ enters your body. A germ. That is, a germ enters your body and begins to multiply and then make you feel sick. Yes. So the germ's place is not your body. And so when it finds its way inside your body, then we say you have an infection. Yes. I didn't say bacteria because there are different types of germs. So bacteria is one group and there are three others. So we have the viruses, bacteria, we have parasites, and then we have the fungus or fungi. And all of them, when they get into your body, they are not supposed to be there. So they make you sick. Those that are supposed to be in your body are already there. And so when they are already there, you don't fall sick. But when the foreigners enter the space, they don't go and sit down quietly. If the body is able to manage them, then they are killed. But if they get a free ride and begin to multiply, and they have a way of multiplying so fast that they begin to take over territories that are not theirs. And when they do that, then your body begins to complain and then begins to call for support. And so they marshal more soldiers in the body, that's your body's immune system, and begin to fight as hard as they can. And hopefully if they are able to overcome, then you are the winner. If they are struggling, then you will need medication to help you bring the bad boys under control.
So if I get you rightly, there are times when germs are introduced into our bodies, but we don't feel it because our bodies are able to deal with the germs. But when you begin to feel sick or begin to feel pain, that's when your body is a bit overwhelmed and needs support to deal with it. Is that it? Or there are times when you can feel the pain, but without medication, you can still overcome the infection.
Absolutely, yes. There are some that the body will still overcome with or without help. And there are some that you would need additional help to get the body to overcome. And so that's why sometimes you may have a little fever and then it goes away. And well, you had a little headache and it doesn't come back again and you bounce back to normal. Your body overcame whatever went in there. But a few other times the fever will continue to rage on, the headache is not going away, you feel tired, then you realize that the body may need additional support to be able to overcome. So depending on what goes in and what the germ is able to do, you may or may not
need an intervention.
Yes.
What are the signs and symptoms of infections?
That's a good question. Signs and symptoms of infection depends on where the infection is.
Okay.
The germs can enter any part of the body. You can have infection of your head, your scalp. You can have of your skin. You can have of your eyes. You can have in the nose. It can go into the body system. Yes, where you pass urine, anywhere. Your feet, yes. And so depending on where the infection is, it will present a bit differently.
Okay.
But there are some common things that are common for children. So you may have pain. If it's on the skin, the head, you may have discomfort there. Yes. You may have a fever, high temperature. When we say fever, it's high temperature. Okay. Yeah, so fever doesn't mean malaria, as we sometimes people loosely describe. Fever is high temperature. And high temperature is when your temperature is above 37.5 degrees Celsius. So please, if your child's temperature is 36.5, the child is fine.
Or even 37.
37.0, please, the child is fine. 37.2, the child is fine. Is when you hit 37.5 and above, then we think that it's gone beyond the normal body temperature. So that is fever. If the infection is in your breathing system, then you may cough, you may sneeze, you may have running nose, or sometimes you may have a sore throat, which is pain in the throat. Yes, so pain will be there, and then these funny symptoms that show that the body is trying to get rid of the contraband So those are other things. And then if it's on the skin, sometimes you may have an itch in addition to the pain. And then you may see all these rashes and other things that are not normal people on the on your body. If it's the tummy, you may have abdominal pain. Yes. Sometimes you may vomit. Yes. Or sometimes you may have watery stools or phlegmy stools. Yes. So depending on where the germs get to, your body responds appropriately. When the germ goes everywhere, then there's chaos. And so you get headache, you can get pain in the throat, you can get pain in the chest. Your whole body begins to complain because the germs are everywhere. And so they make you tired, they make you weak, they make you sick. And so, yes, that's what happens. So when it's all over, then every part of the body complains. So wherever the germ goes, that part of the body begins to complain that they are here. They are worrying me. And then the body's immune system also tries to marshal up everywhere. Yes, so that's pretty much. And then, of course, you can also have a swelling. Yes, you can also have a swelling. Yes.
What's the most common infection in children?
In children, it depends on the age group. And so if it's a newborn, let's say under 6 months, it tends to be more of skin. In our sub-region, yes, because the younger ones, normally, unless they have an older sibling or an adult brings a cough or something, they don't get a respiratory because they are always hiding in the house. Yes. But then sometimes with the handling, everybody comes to visit and he takes baby. And so they may get more of skin infections and then sometimes respiratory tract, yes, infection. And then, of course, they can get a whole body also infection. Yes, if whatever got into the body gets to travel all
to
over.
other parts.
Yes.
I'm guessing for toddlers it's colds, right? Because then they begin to go to school, they begin to get exposed,
Good.
play around.
Good. For the children who are going to school, yes, it's the respiratory tract. So that's common cold, throat infection, ear infection. The ear and the throat in children are very close to each other. So the throat one sometimes travels into the ear. And so you hear they say my child has otitis. Or you go and the doctor will look in the ear as well, and you are wondering, I didn't complain about the ear. What are you doing in the child's ear?
They look deep into the throat.
Yes. If you don't look, you'll be embarrassed. Yes. So those are the common infections in children. Of course, also tummy infections. When they begin to pick things and put into their mouth, then they also get the tummy upset. For school-going children too, they can get, when they start being potty trained, then they can get infections in the urinary tract. So the girls can easily get infected because, you know, our anatomy, we sit.
Yeah.
Okay, for the boys, they are blessed to have it hanging out and so, but we sit. So if that child is being potty trained, then they keep sitting on the potty and they can share. The bad, yes, the germs.
So in that instance, since we've brought in the issue of the urinary tract or infections in that area, it's likely going to be an itch, right, in terms of the symptom?
Sometimes itch, yes, but it tends to be more of pain than itch.
Okay.
Yes, so they hate it. They are passing urine and they are complaining. Or you are bathing them and you want to wash and they don't seem as comfortable as they usually are. One of the features is also that they tend to pass urine more frequently than they should. So for those who have stopped wearing diapers during the day, you see they keep running to the potty.
Okay.
Oh, I want to pee, I want to pee. They go and very little pee comes. But the noise he made prior to going to pee does not match the volume of pee because you thought he was going to virtually
empty everything.
You know, yeah, get you like 1 liter urine, but he goes and it's like 3 mils. And so, yeah, so those are some of the signs. But the interesting thing about urinary tract, sometimes all these things may not show. Okay. And so it's tricky. It's tricky. So that's one of the things that the doctors are trained to have at the back of their mind. If the child comes with a fever, is not eating well, yes, I forgot to add, but poor appetite is also one of the symptoms of infection. Yes, not eating well, not growing well, look for a UTI.
Okay.
Yes. So you can always suggest to your doctor sometimes. It's okay. Doctors don't get offended when you suggest to them. Yes. A good doctor should not be upset. So please feel free to engage your doctor politely. And sometimes if he has forgotten, he would remember and say, that's a good differential.
So, how do we prevent or protect babies and children from getting infections? Or is it the case, as some suggest, that these are avoidable? In fact, some people argue that introduce your child to the germs around you. They believe that it is what will help the child get immune to them early. So, allow them to play, allow them to put things in their mouth, let them build their immunity. If you shield them, they may grow and then it may be a problem for them. Does that make medical sense?
Yes and no.
Okay.
Yes and no. I say yes for those who are paranoid, literally. Some of us have become overly protective of our children. And so even when we go to social places, we don't allow our children to socialize. Okay? He's going to another child and you are pulling your child back because your child will get infection. You know, I had a friend who would bath the child every time he stepped out and came back in.
Every time?
Every time, literally. So once I was having a chat with mom. Little girl comes out of the house and she starts scolding the child. I just finished bathing you. That means, so then I was like, but what's wrong with this little child coming to the porch? So that means she has to bath again. So I jokingly said, please stop this. Okay. But then in that instance, yes, allow the child to play. Allow the child to walk. Allow the child to fall. Yes. But I said no for those who intentionally expose children to dangerous germs in the name of building immunity. The immune system will be built with or without your help. God has programmed our bodies. So when a baby is born, he has immature immune system. He depends on mommy for protection. So they come with some mother's antibodies. You know, we've talked about that in breastfeeding. So they are put them from 6 months. Mommy's protection is gone, and they begin to build their own. That's why we are very particular about malaria around that time, because mommy, you come with mommy's, and then around that time, mommy's is gone, and you have to get your own. And yours is also not fully matured yet. So, but then the body's immune system will be built, with or without our overzealous introduction of germs. And the risk with that introduction of germs is you don't know which germ, you don't know how well your child will be able to fight it. And so there's no need exposing a child before time with the mind that I want to build immunity. What if the child is not able to fight it and succumbs to it? Then you have caused yourself a lot of pain, a lot of stress for this poor baby. And sometimes these germs leave you with side effects that you wouldn't like. And so after that infection, if that child is not able to function like he was programmed to function, then you have not helped your child. And sometimes the common ones that we think it's okay can have terrible consequences when they really go out of bounds. Yes, so sometimes you think it's just the nose. Wait till it gets into the brain. They know that the game has changed. And so why did you expose that poor child? Because you don't know which child has the kind of immunity that will make sure that the germs don't travel to certain parts of the body. We can all get common, let's say, popular chicken pox. Some of us will just have the two
Honestly,
round.
yeah, the people who just even actually just feel feverish and just one
or two
pox on the
just
skin
to announce the presence that it's chicken pox, and that's all there is. Others get it and you cannot even see their eyes. They are just draped in the pox, okay? And this virus can cross into the brain, okay? In some instances, when the child's immune system is not ready, is not able to cope well. It's not common, but how do you know your child is not going to be that child? And so please, when there's an infection, don't put a poor child in there. If you want to try as an adult, have fun, but leave our children out of that.
So, Doctor, this has just brought to mind a question. What makes a child more immune to a disease than another one? Because I'm just wondering, is it biological? Is it what we're eating? Is it supplements we are giving? What is it that allows for one child to react differently and the other very poorly to probably the same kind of virus or germ?
It's a combination of all that you've mentioned. Our genetic makeup is one. The environment we find ourselves in may play a role, because sometimes you have been subjected to so much that your body is already complaining. And then an important thing is diet.
Okay.
What you feed your child determines sometimes how prepared they are to fight the unwanted visitors. Okay, so all these factors come to play. Sometimes the person may have had an infection, their immune system is tired fighting, they just finished one job, and then another one comes in. And so you realize that sometimes when you are sick, you get to fall sick
consistently
in sequence for a while before the body stops everything. So you may come down with a common cold, as you call it. You go to hospital, you realize this cold is just dragging on. Temperatures are not settling. You go and they do a blood test and they will tell you have malaria as well.
Okay.
It is not because they were cooking, but then malaria was sitting there. The body was coping till Brother Cold came to say hi. And then they form a beautiful team. And so now when Brother Cold is being kicked out, Sister Malaria holds his hand. And so together they are stronger.
They formed an interesting alliance.
A very good alliance. Until you get rid of both of them, Brother Cold will go, because Sister Malaria is holding his hands.
And so that's why you may be giving the child medication to fight that cold, but it's still persistent.
Absolutely.
Right.
Okay. Or he's got a throat bacterial infection. And you know that this medicine should take care of it. But this child looks more sick than whatever they are seeing in the throat. You check, and then you realize that, he has there's an alliance. Okay.
Does every infection present with a fever?
No, not all infections present with a fever. I talked about skin infections.
Okay, so those ones don't come with a fever?
It depends.
Okay.
Let me use the skin. You can have a fungal infection, or you see some patches on the body. It doesn't come with fever most of the time, because it's not gone into the bloodstream to cause so much. The body's immune response does not generate a fever to fight that, unless it's all systemic and it's gone to everywhere in town. So yes, but then on the same skin, you can also have a viral infection, like measles, like chickenpox. They are all viral infections. That one will come with a fever. Bacterial infection, what we call in tomatoes and impetigo, or even boil. You may get boils and then the child will run a fever. Yes, so it depends on which organism, but it's not always that an infection will present with a fever. Even malaria. There are instances when malaria may not present with a fever.
Okay.
All you see is that the child is not his usual self. He's not playing as he used to. Appetite has gone down. He's a bit whiny and fussy.
Okay.
That's all there is to the child. Of course, when the germs, the malaria parasites multiply to a point, fever will occur, because fever is more of the body's response to fighting the unwanted bugs. And so sometimes when the body mounts the response, it may be with or without the fever. Okay.
Very interesting conversation we are having here today on The Baby Doctor. I know you've learned a lot. And if you just joined us, we're talking about infections in babies and children. And Doc has basically told us what an infection is, how it's likely to present in your child. But I just like the bit on where she's talking about the ones that usually do not appear with the fever. So especially if your child hasn't developed the skill to speak yet, she's shown us what to look out for. General mood You know, is it different from what your child would typically be? Happy, cheerful? Are they lethargic? Are they, you know, just not as playful as they usually will be? And Doc, I have always wondered, for you doctors, especially for the children that cannot talk, because as adults, when we come to the hospital, before you even run a test, it's important that you speak to the patient to ask, okay, show me, where do you feel pain? What is wrong? Do you have a sore throat? Do you have this? Do you have that? Before you even run tests, because I believe all that helps in your diagnosis.
Absolutely.
For the children that cannot speak. And maybe, in this case, they may not be presenting a fever. They may be feeling a pain in the throat. Just tell me how you go about handling the kids for them to give you certain cues about, you know, what's happening to their bodies.
It's an art. So you learn, you are taught. But then I gave a few. A child who used to eat this portion of food suddenly does not want to eat. I will talk about the nose and throat because it's the common place of infection. This child who used to love his yam and rice now doesn't want to swallow rice. All he wants to do is to drink milk or drink Milo. Or he would refuse every meal, but he would be drinking water over and over again. He's crying, he's playing, then he stops to cry a bit, and then continues to play. Okay? He takes food from you, he takes a bite or two, then he leaves the food. And that is not his normal behavior. You know, there are some who have a reputation for biting and leaving every piece they get. So we always ask you, is there any change from his normal?
Okay.
Okay, so when you notice that there's something different from your child's normal, that is a sign that there's something amiss. Yes, or if is he spitting a lot, is he drooling? Okay, yes. Is he fussy? Is he clingy? Is he a child who normally is very sociable, but now has become very clingy? Those are all cues that all is not well with me. Yes, so those are the early signs that every mother will be able to notice. Sometimes we misinterpret them to mean and the child is being too fussy, and if I can borrow the local word, we cry
It's a pampered, spoiled
He's a spoiled child. And the worst time is when they tell you that because you've taken seed as a mother, and the heat from you is making the child sick. It's one of the myths that...
We'll be getting into the myth busters, Doc, because there's one I heard recently that made me wonder. I was like, this one, where did it come from? We'll come to the myth busters soon.
Soon, yeah. So,
but also on the bit of what to look out for, how do I determine that this is the time to take my child to the hospital? I'm asking this because there are times when some healthcare providers will tell you, you can manage it at home. You can manage the symptoms at home. So here's what I'd like you to do for us. Tell us how to manage the symptoms at home.
okay.
Then later, share with us when to decide that this is the time
It's time to move. Okay, so since many of our children are going to school now before time, trust me, now we have children who are in school already at 6 months. And so the things that in the past you wouldn't see in a 6-month-old, now we are seeing because they are going to school at 3 months. So by 6 months, they are behaving like a child who is a year and a half or two. Yeah, so respiratory tract infections are common. And of course, they present with a runny nose, sneezing, and then being fussy, blocked nose, not sleeping well at night, not eating as he used to. So those are symptoms of an upper respiratory tract infection. What I would tell parents is if the child has a fever, the first temperature spike, when I say temperature spike, that's when it goes beyond 37.5, doesn't mean run to the nearest hospital.
Okay.
If the child is happy, playing, he's had his meal, he's drinking, you can give paracetamol and watch.
Okay.
The paracetamol here is to make the child comfortable by bringing the temperature down. For the common cold, you give paracetamol and watch. And then within a day, the temperature will stop. You didn't need to. If the child is not eating, he's crying, he's refusing everything, not drinking, even if it's just one temperature spike, you've given your first dose of paracetamol, there's no improvement, you move to the hospital. So you see, I've given you two scenarios in the same day. The first scenario, baby Joe is eating, baby Joe is nibbling at everything, he's just having a runny nose. And then, of course, the nose gets blocked and he's crying and rubbing his nose. All you need is to ease that congestion, which you can do with a saline Mesado. That one is over the counter. Okay. But the next other one, baby Kwabena woke up, is refusing even to breastfeed. It's extremely fussy. The temperatures are very high.
And very high here means?
Above 38 degrees Celsius. Yes. He's miserable. Baby Kwabena is not even drinking to keep him hydrated. Okay, he's refusing. So that means there's so much pain somewhere. Okay. And so in that case, you are better off taking baby Kwabena to the hospital. Maybe waiting a day or two may not be great, because baby, and more often than not, prior to that day, he may have been a little fussy, but we took it as he was just being himself, tired and fussy. So those are two scenarios that you have to. So give paracetamol and watch is good, but in some scenarios, I think the delay may be too expensive. So that's how I'll answer that question.
Usually for adverts, especially for adults and pain medication, they say consult your doctor if the symptoms do not get better after 3 days. Is it the same with babies and children, or 3 days is too long to wait?
If he's eating and he's happy, 3 days is fine.
Okay.
Because we know that normally when it comes to these viral infections, it takes 48 to 72 hours for the fever to settle. Okay. But that if he is deteriorating, then the 3 days may be too long.
Okay.
And so I'm careful not to prescribe days for children. And I always say mothers' guts are always, don't feel them.
Okay.
And so when a mother is, as a mother, when you are uncomfortable, it's okay to move. If you go and you are sure that he'll be fine, you come home and then you have that peace of mind. So it's not bad to go and be told that it's viral and will not give you antibiotics. At least then you know you are dealing with a virus. And so within the next 3 to 4 days, everything will be fine. And so they will teach you what to do. Yes, so that's how I will answer that question. I think recently a client made me laugh. She called, very frantic. The child has not slept the whole night. His nose is very blocked. Should I move him to hospital? And this is an old. So my next question was, have you put any nasal drop? No. So I said, you have saline? Yes, I do, from the last visit. So just put some in his nose and then give him paracetamol. If in 30 minutes he's not better, you can bring this child. I saw them a month later, and that was for another reason. So you see, there was no need for this woman
to move to
the hospital, pay consultation, for me to send her back home to go and use the very saline that she had.
Doc, we'll take a quick breather here to sip on some water. When we come back, I would like for you to tell us what the appropriate way to administer these symptom management drugs are. Do I give it and wait till I see a surge in the temperature again before I administer the next dose, or there's a way to do it? I like the way Doc is smiling. And also, how to tell, because this woman's fear, I'm sure she was thinking her child may have breathing complications. Usually we think so. What's the difference between a normal cold, and how do we look out for actual breathing complications? I'm saying this because of the infections and the colds and all that, so that it can help mothers and caregivers be at ease. So do stay with us. Doc and I will be back to answer those questions, and then we'll go on to deal with some myths.
Get ready for an unforgettable experience filled with laughter, education, and quality time with your loved ones. Introducing the Koi Family Fun Day, where friends and family come together for hours of fun, entertaining games such as trampoline, bouncy castle, face painting, table tennis, Scrabble, Ludo, musical chairs, you name it. Join us on the 4th of August 2023 as we gather for a spectacular day of bonding and friendly competition. There will also be a health corner where our specialists offer dental checks, eye checks, counseling, and many more. You may be a seasoned player or a first-time participant. Come to the SOS Village Car Park at Tema Community 6 between 10 a.m. and 5 p.m. There's something for everyone. Koi Pediatrics, your child's well-being, our passion.
Thank you so much for staying here on The Baby Doctor with me, Bernice Abu-Baidoo Lansah. I'm so excited that you make time to join us on this very important show. Dr. Koi and I have been discussing infections in babies and children. And just before we took that breather, Doc, I was talking about when the most appropriate time to move your child is, when you are managing symptoms, especially of cold and flu at home. And we came to the conclusion that when the temperature spike is not too high, 37.5, you can manage that with pain relief medication. But the next important question after that is, how should I administer that pain medication? Do I give it every time there's a spike, or I follow the usual dosage, you know, that is prescribed?
Okay. If you are given medication to manage temperature, then you do it as prescribed.
Okay.
You cannot do hit and run. Okay? So if a child had a high temperature for which you decided to give paracetamol or Calpol or Tylenol, I must say they are all paracetamol. Sometimes you hear people give this and think the other one is different. No. Oh, yeah. So then you do it as prescribed, and it's either 8 hourly, so morning, afternoon, and evening. Okay. If the whole night there's no temperature, you can stop the following day. Okay. But when you do and you wait for the next high temperature, it becomes more difficult to manage the temperature, and then the child gets fussier and you are more frustrated. Okay, so that's what I would say. And then I must say that yes, you can manage some temperatures at home, but by day, after second day, if the temperature is not settling, please move to the hospital.
Okay.
And let's be sure that whatever you are dealing with is still your common cold that you think it is, or it's the child who's just tired. Or the popular one, teething.
Yeah.
Yes. Teething is given so much credit. Sometimes amazing. 39.5 and they are still talking about teething. Teething hardly gives temperature above 37.4.
Okay.
So normally when you have temperature 37.5 and above, just confirm that it's everything else before you give teething credit.
Okay.
Those who get teething fever above 37.5 can be counted on a finger. They are the minority.
Okay.
Because often people would, and then we go for teething syrup, which is paracetamol, I must tell you. And so we keep giving that. Sometimes we go through 2 whole bottles of paracetamol and teething syrup, and then sometimes we change our mind and go for suppository. It's still the same medication. Okay, so when we say 3 times a day, be it your teething syrup, which I really don't recommend,
Okay.
or your paracetamol, or the suppository paracetamol, or the Tylenol sachet, it's still 8 hourly. Any of which
6 hourly or 8 hourly? 8.
It can be 8
or 6.
or 6.
Okay.
So if, for example, the child has had one, and then by 6 hours his temperature is rising, you can give the second dose. But if the child is fine, then we recommend that you do it 8 hourly, so that you have 3 doses in a 24-hour cycle in a day. Okay, so that's how we do it.
So I'm learning something, and I hope you are too. It's inappropriate for you to give paracetamol and teething syrup at the same time because they're both paracetamol.
Yes.
So you just want to be careful because then you're giving your child an overdose. And Doc is tackling this because I believe that you have had cases of abuse of paracetamol, especially when it comes to babies and children.
Yes, yes, and it's a source of worry because And I must add, before I talk about paracetamol, you will observe that I kept quiet on ibuprofen or brufen syrup. Yes, it was intentional, because for some children, there may be reasons why they should not take brufen.
Okay.
And so you should be careful that you don't overly do it. And that's why I was careful. But if your child has been cleared to use brufen, then brufen is also used to manage fever.
Okay.
And that one is also 8 hourly, just like paracetamol. Yes, and then in extreme cases, that one is for the doctors to decide, so I won't put it out there for mothers to go and
try their hands.
experimenting. Yeah, so about paracetamol and teething syrup. For the worst culprit is the teething syrup. People think that from 4 months, every day when they bath their child, you should get a dose of teething syrup together with some multivitamin. And no. Paracetamol destroys the liver. And I remember when I was much younger, I saw one that broke my heart. The child came with bad liver damage. That child passed. And why? The child was then about a year. Mommy had been religiously giving teething syrup every day for more than 4 months.
Wow.
That was heartbreaking. It was out of ignorance. But she had done so much irreversible damage to that child. So the para that we disrespect and we keep popping in our mouth like Smarties can destroy the liver. So if you take it as prescribed and in moderation, you don't have to worry about it. So please, if you are taking para and after 3 days you still need to take para, go and get help, because you cannot take para for 2 weeks, okay, because you'll be abusing the liver. But if you have to take para for a week for a good reason and the doctor is in charge, I mean, it's told you clearly what, for example, if you have a broken bone, for which reason you have to take pain relief for a little longer, that is prescribed. And even then, when the pain goes down, we will stop. Okay. And more often than not, they may even change at a point from one pain medicine to the other. But please, be very careful about this paracetamol that we disrespect and think it's like a kind of a multivitamin. It is not. Okay. It is a very dangerous drug. Just that it has great benefits. Okay. And if you use it well, you don't get into trouble. And so don't worry about, because of that, the child is raging 39.5 and then you are not giving anything because Dr. Koy said paracetamol. Please, I didn't say don't give paracetamol. But please don't abuse paracetamol. Okay. Okay, good.
Right, Doc. There's a big debate I saw on social media about whether or not to give a child a pain relief medication before they come to the hospital. There were a group of nurses who said, well, it's always best when you come to the emergency with 39.5 and we ask you, have you given something for pain relief? And you say no. We are worried the possibility of a seizure, which could cause further damage to that child. But there are those who also say, no, when you do that, you inhibit our capacity to properly diagnose. I don't know what your take is. When it comes to pediatrics, I am very careful because sometimes what you hear mainline doctors say, especially about kids, may not necessarily be in sync with what the pediatrician who has specialized in childcare will tell you. So I know there's that bit of I don't want to say a war, but there's just some fine lines of disagreement when it comes to children and babies. So you tell us, what is the best to do? Okay. Are we worried about seizures when the child's temperature goes very high?
Yes, some children will fit at very high temperatures. And I will answer the question you asked this way. For me, a history of fever, that is when you come and you report fever, is as good as the one I feel on the body. Okay. So my answer is, please, if your child's temperature is very high, give, we call it antipyretic, anti-fever medicine, para-brufen, whichever you lay your hands on, if it's okay for your home. Yes, so you give it. Just what I will appreciate is if you have a thermometer, and I encourage every mother to have a thermometer. Don't go for the sophisticated one. Even, you know, the one I call PPPP, the small one we put in the armpit, it's good enough, you know. So don't spend a fortune on a thermometer, but get a thermometer so that when you measure and you know it's 37, above 37.5, you can administer your please administer your fever medicine before you travel to the hospital, because in Ghana, traffic alone can change your anticipated time of arrival. And there may be some delays, even when you get to the hospital, registering, doing this, doing that. So there's nothing wrong with a parent giving paracetamol. So far as she has taken the temperature, and when she comes, she can share that I recorded this at home. Okay. Temperature in history is as good as temperature that I feel.
So please don't just feel the child and say he was very hot. How hot? You can't describe it, you know. So you need a thermometer. And doc, thankfully now, when you go to the baby shops, they have some kits that contain these thermometers, yes. Sometimes a manicure kit or yes. something to help groom the child, and they include that. So I don't think it should be a difficulty for parents and caregivers to have thermometers.
No, and I must suggest that when you have one, please try it on yourself on a normal day. Okay. Just to be sure that your thermometer reads.
Doc is right.
Because sometimes the thermometers read values that a human being cannot have. Yeah.
The problematic ones.
You know, sometimes it's so low, I'm like, this child must be a fish then.
Frozen one as such. Frozen fish.
You cannot live with that kind of temperature. But if you check on a normal day and it's always okay, then you know that on the day that you need it, it will not let you down.
Right. Yeah. Right. Or if you are like someone I know, just have two. I mean, if you can afford it.
Yeah, you can.
So that you can even compare the values and be sure that you're not being tricked by one thermometer or the other. Doc, so there is also the concern about the spread of infections. And I'm asking this because there are some who would immunize their children against the common flu because in schools it spreads a lot. Or even at home, one child brings it and does not only affect the other children, but sometimes the adults at home who will give them the care. So everybody is down because one child brought a cold or a flu. How do these infections spread, and why do they spread so fast?
Good question. The infections spread, there are about 4 routes. So we call some airborne. Okay. Okay, that one you sneeze, somebody coughs, somebody is talking, droplets from the mouth. And so,
just like COVID.
Yes. So that's how COVID got popular. We are having a conversation, and by the time we leave, you've given me some dose of COVID because it was airborne. And then we have those that is by direct contact or indirect contact. So, for example, chicken pox. Let me put, some people say, maybe I shouldn't use chicken pox. But then anything that maybe you have the infection on your skin, yes.
Let's say the
boils, yes, or the hepatitis with the tomatoes. Yes, you discharge, you touch a surface, or you discharge, you touch me, and then you give it to me. Because the fluid from my body goes to your body, and the bacteria gets a place to enter. And then he's found a new home. Yeah, because normally if it stays on the skin without a break, it doesn't get anywhere to enter, it will die of the skin. But sometimes, you scratch, there's a little discomfort, you scratch, and then there's a little break. That doesn't cause pain, but it's enough for that little boy to enter. So that's how babies get. And then also, so that's how we get it. And then also we have the vector one, like our common one is malaria. But you can have it from cockroaches, droppings, from bites from all other insects. So those ones you need somebody, for malaria, people don't know, it's the female anopheles. He will spit it out into your body. So when he bites me and I have malaria, he comes to you. He will offload all that he got from me to you before he takes fresh blood from you. And that's how they get it. So that's the vector one. And then the final one is it needs a vehicle. Like somebody should carry. So that's where the food vendors get very important in our lives. Yeah, so contaminated food. I eat it, then I get it. So whichever way the contamination happened, the key thing is so far as I put that contaminated object into my body, then I get it. So for children in school, they are crying. So droplets. Okay. Yes. Or he picks a toy, puts it in his mouth, he puts it down, and then
another one
picks, how it goes. Or one is have a nose discharge, teacher cleans it, and before she could go and wash her hands, Inshira falls down, and she quickly goes to pick Inshira and puts Inshira on her chest. And so Inshira stops crying, but Inshira has been blessed with Inkunim's bags. And that's how that's how it spreads. So When they are together, it's difficult. Okay.
Right, Doc. So, usually at home, right, in other parts of the world, when a child has a cold, it's a big deal. Sometimes you're isolated, kept in the room. Just mommy is coming, checking your temperature, giving you some soup or some hot beverages to, help you manage the symptoms and give you medication and all. I mean, would you say we should do that? Isn't that extreme in our local settings or at home? What is the best way to prevent or reduce the spread of infections?
The best way, like how we behaved when we had COVID. Okay. Yes, and wash hands. Washing hands is so important. And then the cough etiquettes. So I think personally, if you ask me now, if somebody has a respiratory tract infection in the house, the person can wear a nose mask.
Okay.
Okay, so that he keeps the droplets to him or herself. Now, nose mask is common thanks to COVID, so it's okay. If you still have some at home, you could use it. Or you wash hands often with soap, not with just water, and then you clean your doorknobs. You disinfect them. So that if there are any germs there, I kill them, that's all. And with that, and then everybody should just do the basic. Yes, then everybody will be safe. So you don't have to isolate the person unless it's a life-threatening organism, like COVID when it came. But other than that, it's okay. And if everybody's eating well and eating healthy and having a lot of, well, that's why we give them all the fruits and everything.
Yes.
So everybody should boost their immune system in that case.
And the multivitamins, do they help the children?
They do help. And so for children who go to school, there is a place for multivitamin. Especially now for the common cold, we know those that are rich in zinc and vitamin C are good. And so it's okay for a child to have a multivitamin with zinc every day. You are boosting the immune system so that he can shove off some of the little infections without falling sick. So there is a place for multivitamin.
Okay.
Yes, there is a place for multivitamin.
Now let's do this exercise I love doing a lot, because when it comes to caring for babies and children, there's so many things we hear, so much information that is handed to us from generation to generation. You understand what I mean? And we need to determine whether we are getting it right or not. So, Doc, our Mythbusters, true or false? Green nasal discharge means the child has a bacterial infection. Earlier, you mentioned the types of infections: fungal, viral, bacterial, or parasitic. And for the viral, like you said, it will run its course, so you just manage the symptoms. After about 2 weeks, the virus does what it wants to do and it's gone. But the bacteria is the one that needs antibiotics and all. There are some who say, oh, if the discharge is greenish or yellowish, then it means that it's a bacterial infection. That's when you go to the hospital. True or false?
Not necessarily true.
Okay.
Okay. This is because normally when it starts, it's clear. When the white cell, that's the soldiers of the body, when they go there and they are fighting, then the dead cells begin to change the color of the discharge. And so it will, when it stays longer, the first day it will be clear, then it becomes yellowish. And then sometimes it may get greenish because a lot of dead tissue and a lot of bacteria, the viruses or the germs, for use that's the appropriate word, have been killed in the process. And some of the white soldiers too have died and are coming out. So yes, so if the child is fine, normally the greenish one will be like after a week of the clear, and the child is not running any fever, it's okay.
Okay. The next
but
one.
But then if it's immediate and the child is very sick, like what I described earlier, then you should go to the hospital. Yes.
All right. The next one, putting an onion by your bed will draw out the cold or flu. I saw a video where a woman was demonstrating, and this is called, there's a word for it, where they talk about using nature to heal. I've forgotten the expression. It just went out of my head. But putting an onion on under your child, wearing them as socks will pull out the cold. True or false?
It's false.
Right.
It's a virus. I don't know how the onion from under my feet would deal with something in my nose.
Interesting. You've touched on this, but just in case someone just joined us, teething causes fever. True or false?
Teething doesn't cause high temperatures.
Okay. Now, it's best not to treat mild fevers. And Doc has shared with us what a mild fever is. So if you're doing just a little around 37.5 to 38, that's mild. But from 38 and above, you're talking about a fever with high temperatures. So some say, oh, if it's 37.6, don't treat it. You know, it will go on its own.
If the child is happy, not crying, not uncomfortable, you can watch and pray.
The final one, cold causes ear infections. How true is that?
I think I answered it that they are next door neighbors. The throat, the nose, and the ear. And so the bacteria or the virus that sits in the throat sometimes causes the inner ear pain. So they are cousins. So then the throat infection can cause an ear infection.
Oh, we've been learning a lot here on The Baby Doctor today. If you missed any part of the show, you need to catch the repeat or get onto our YouTube channel or on Facebook and watch it. Share the information with somebody, even if it's somebody who cares for your child when you're away. It's important that they know all these things. This is a family show, right? So it's not only for mothers or caregivers, it's for the entire family, because when mommy is not around, somebody may have to take a decision that will impact baby or the child's life. So it's important. We'll be back, but here are some tips for you, and then we'll be back with some more information. Do stay. Hey there, thank you so much for staying on The Baby Doctor. And today has been exciting. We've been learning a lot from Dr. Coy. And Dr. Coy is with Coy Pediatrics. Do you get the correlation? Yeah, Coy and Coy Pediatrics. And she's got 2 locations in Tema, right, Doc? Community
Yes,
16?
Community 6.
6, rather.
And 25.
And 25. So you can pay Doc a visit. She'll be ever ready to help you. You know, when she talks about children, you see how excited she looks. It's not because she's on TV. That's who she is. She loves them to bits, and she'll go all out to ensure that they are hale and hearty. So just a simple Google search will help you locate Coy Pediatrics, C-O-Y Pediatrics, and you can visit her. It's open 24 hours, right, Doc?
Yes.
Open all the. So it's an exclusive children's hospital. You haven't heard of that before, have you? The only one we know are owned by government. So Coy Pediatrics is doing some good work, and the staff there are friendly, they are lovely. I have reached out to them a couple of times, way before I met Doc, so I know what I'm talking. I'm not saying this because she's sitting here. So they've got some good stuff for you, so you can find them. By a simple Google search, you will find them. And I've been bringing you this from Think Media here in North Kaneshi. Think Media is your creative agency. Anything you need creative-wise, planning a program, implementing a strategy, whatever it is, just contact Think Media. And what do I say to Azel Vogue for this beautiful dress? Someone told me, today you look like a baby doctor. You're looking so colorful. And I'm grateful to Azel Vogue for this dress. You can contact her on 0244 155 266. 0244 155 266. Tell her you watch The Baby Doctor. She'll give you a good deal. For all occasions, we've got beautiful dresses for you from Azel Vogue. I'm Bernice Abu-Baidoo Lansah, and as I always say, we are all about keeping babies happy, because a happy child makes a happy home. See you in the next edition.